that's primarily what I have to suggest on that. All right.
Thank you.
You're welcome. Anything else with anyone else? Yes, Carmela.
Why did he ask the question about the knee? Because I came to the meeting a little bit, few minutes late. Why the knee, please?
Okay, sure. Well, actually, the question was not about, the original question was, if I had anything to say about the Ito magnets, and my response was, I actually don't use them a lot, but Ito had a diagnosis for 8 extra channel treatments taken from the knee. So if you have outer knee eye, that's Sanjiao 5, gallbladder 41. If you have inner knee eye, that's spleen 5, pericardium 6, but could be considerably on the other side, opposite side. And if you have liver 8, it's supposed to be kidney 6. So that's where it went. And then I said, instead of kidney 6, I tend to use kidney 7. So I took some of these ideas, but I'm not as versed in this whole thing as some people are. And I will use spleen 4, pericardium 6 sometimes for knees, but I generally tend to give preference to stomach 41, spleen 5. That tends to be a much stronger combination in my experience. Okay, but that may be very different for other people. So, so the question was really more about this Ito 8 extra channel diagnostic. He had a way of diagnosing things. Because there was a period in Japan that people were very fascinated by the idea of using the opening points of the 8 extra channels. I think in the 60s and 70s, I'm not totally sure. So that's really where the question started from.
Mm-hmm.
And it's supposed to reflect, I mean, I guess in Ito's view, it was supposed to reflect your constitution. Now, if you ask me why that, my understanding would be that your weight ultimately falls at either your ankles or your knees. So your knees have a regenerating capacity. I've talked a lot about that in the past. So if you look, for example, for you, specifically, if you look at the word for knee in Hebrew, it's berech, which comes from the word brecha or bracha, meaning a pool or a blessing. A blessing actually comes from a pool, the pool of water, the source of water. In French, le genou, genou comes from the same word as generating, to generate. Okay, same idea. I'm told that in Farsi it's the same thing. I don't know Farsi, but I have a patient who explained it to me, and I can't say the word. In Chinese, it isn't. Not by word, but what you see if you look at the names of the points around the knee, you have 3 chuans, pools. Okay, same idea, that a pool generates, pushes upwards, generates movement. So you have Yinling chuan, spleen 9, you have Yangling chuan, gallbladder 34, and you have Chu chuan, liver 8. Okay, so you have this, the Chinese see the same thing, that if everything just falls down into the knee doesn't generate anything. There's too much falling down, and as some of you know, I'm very much in love with this whole thing about push down to push up. So it's so of course for me it's very I like the idea of this chuan, the generation from the knee. But anyway, does that answer the question?
It's very good, actually, because a lot of clients were talking about knee pain. When I just was talking with clients, they talked about knee pain on the first day of the corona and closing the clinic. The first thing that happened to me, my knees were killing me. I was having so much pain in the knee. So I was thinking about this emotional kidney and fear, and the knee swelled. So this is why I said, why the knee? Why people are talking about the knee? Because people complained about the knees. I don't know if other one had this experience.
Yeah. Anyone else?
I have used the stomach 41 and spleen 5 for a few people with iron pumping cords, and they most have said they've seen a big improvement.
Yeah, it's a great combination. It's really, well, I use stomach 41 lots regardless. For any structural issue, I use stomach 41, usually needle towards kidney 6. because it's sort of like it's the axis of the whole ankle is on stomach 41. The name of the point really means, well, you can make a lot of anything if you want. I can't, it's like a ravine that divides, which I'm assuming refers to the fact that there's all these tendons. Now, by the way, I found out recently that where I take stomach 41 is not officially where it is, that it's supposed to be one tendon over towards the gallbladder. Then I take it, I go from liver floor one tendon over if possible. Sometimes you can't because the tendons are very close together, and needle it towards kidney 6. It's a great point. Sometimes people with back pain, sciatica, whatever, any sort of structural issue, by resetting the ankle, the way the weight falls really helps them. Theoretically, you should be able to do it from the shoe points on the foot, the arch of the foot. The transverse arch. But in practice, either I don't know how to needle it, manipulate it, whatever, but all I can say is that stomach 41 is the one that does it. I mean, you have a number of joints where all the weight falls and gets manipulated. One of them is the transverse arch of the foot, one of them is the ankle, and one of them is the knee. The next one is the hip, but to manipulate the hip is a lot less subtle at that point. So, it's about, theoretically, at least you should be able to do a lot less movement at the arch of the foot. And you'll need a teeny bit more at the ankle and a teeny bit more at the knee. By the time you get to the hip, it'll be a lot. So maybe I just don't have thick enough needles to manipulate it from the hip. I don't know. Something like that. But like I said, the arch of the foot I do use, but it does tend to be, and that is where the shoe points are. So they're important. And on the other side of the foot, on the underside of the foot, you have what they call the jue points, which can be very, very useful. So that area is very powerful, and still stomach 41 tends to be, from a rougher perspective, like my first choice will tend to be stomach 41. Anne-Marie, you looked like you had a question.
Yeah, the points on the plantar part of the foot that you were, what are those points? I'm not familiar.
Okay, so those are called jue points, like jue yin, same, ending points, jue, the character jue is basically a person that's walking on a cliff and like tumbling over a stone, like falling off on a stone. It also means last. Okay, so the character jue also is what's used for, you've probably, when you learned, like in Chinese medicine, they love fainting and strokes and stuff like that. Those are considered jue syndrome. These are jue syndromes. So, for therapeutics, when they talk about that, that was jue. So the jue points, there's a lot of, this character is apparently very prevalent in the Ling Shu Suen. And there is a whole understanding, there's a whole understanding there's discussions about what does this jue mean, besides jue syndrome, or besides like I'm walking and because you can see in fainting how the character fits. You're walking and you're tumbling over stone, you're falling. But so it can have to do with stroke, it can have to do with headaches, anything to do with from the chest upwards symptoms. And those jue points here, they were quote unquote determined or decided by this guy Maruyama, who was a moxibustionist, so you can say they should be moxed. Of course, it's not very nice to needle at the bottom of the foot, but you can. If I use 0.12 needle, so it's the dark green serines.
Okay, yeah,
no big deal. But they are good moxa points. If you find a channel that has a lot of pain, or along the channel, like it's bumpy and painful, I will try the jue to resolve that channel, stuff like that. So the jue points go basically for most of them, take the shoe point off that channel and go underneath it. So for the bladder, go for bladder.
Okay.
Go kind of under, and that will be the jue point, but that will be the jue point of taiyang. So that's small intestine as well. Same thing for gallbladder. Same thing for stomach. Same thing, well, because my hand is a little different, so we'll pretend there's no thumb here. For the spleen will be just under spleen 3, The big difference is liver and kidney. So kidney is actually, the Shao Yin is actually under the kidney shoe, is under the liver shoe point, under liver 3. Okay. The liver is if you take the center of the big toe and you take it towards the shoe points, the line of the shoe points, the liver is actually in the middle of the big toe. So, and that kind of makes sense because some people say liver is on the medial side of the big toe, and some people say no, the liver is in the center of the big toe. So in this system, they're saying no, liver is in the center of the big toe. The one that clearly does not relate to what we would normally call the channel is the kidney under liver 3. So that's the one that's clearly different.
Okay.
All right.
And can you spell the name of the person who developed this?
Maruyama, Maruyama. Maruyama.
Okay. That is someone I'm not familiar with.
He is not terribly well known, generally speaking. You'll find, I believe that in the Kiko books, there's a very short reference to those points.
Okay. Okay. So
John
this
can
is
probably
based
tell
on
you better.
Japanese.
Sorry?
This is Japanese tradition.
Yeah, oh yeah, well, the Jue concept, no, but the particular points, yeah, oh yeah. I mean, Maruyama does not sound Chinese at all.
Right. 'Cause I've trained in Japanese acupuncture also.
Yeah, so he is, and he was around in the 50s, 60s, well, certainly 60s, 70s, 80s, possibly even, no, I think 60s, 70s was his period. I don't think he went through the 80s. So, you know, he's apparently fairly well known. But as you know, a lot of Japanese masters, especially if they did not belong in, you know, like right now, there are some of the meridian therapy types who are very well known or relatively well known and go out and teach. But from earlier periods, we don't see a lot of people in Japan, of course, is, you know, well, just like China, it's very political. So it's, you know, so you do have some people who've made it, you know, who've had translations, like Ikeda and, you know, Shurata May and people like that. But most of us don't have much familiarity with the Japanese, you know, varieties, unfortunately.
Yeah.
And there's a lot of it, you know.
Okay.
A clarification.
Yes, Camille.
When you say the middle of the big toe, do you mean the middle of the fleshy part, or do you mean
Okay.
the middle, like between the two phalanges? Yeah.
No,
Or
I mean, think of liver 1 as if it was pericardium 9. You take pericardium 9 exactly in the center of the
right.
Yeah. Take that and transfer it to the big toe.
Oh, okay. Thank you.
That's the center. So because, you know, there is a liver 1 there for eyes. Okay, for red eyes, you use that liver 1. Okay, but liver 1 generally is taken, you know, because you know how the description of liver 1 is not like the rest of the Jingwell, just like pericardium 9 is. The Jue Yin channel is different. Okay, the pericardium Jingwell point is not here or here, it's here for some reason. Okay, it's at the tip. Now the liver, even liver 1, when you take it in the tradition, they don't describe it exactly like the rest of the Jingwell points. They describe it somewhat differently. So yes, on the official textbook, it says lateral of the big toe, the lateral side of the big toe, where there is the medial side of the big toe is the spleen. But the spleen Jingwell is described teeny bit differently than the liver Jingwell point. Now, there are a lot of discussions about, you know, there's different liver 1s, you know, in the Japanese world, and actually even in the Chinese. So if you go to the center, I don't know if you guys can see, if you go to the center of the big toe, it's a hand, and you can say liver 1 is here. You can also say it's halfway between the knuckle and the edge of the nail. And you can also say the same thing on the side, that it's, you know, because they say it should be where the 3 hairs are. Well, I don't know if you have 3 hairs, do you have 2 hairs, maybe you have no hairs, you know, it's hard to say. But you can also take it like where the liver channel is, you know, leading towards liver 2, but not quite as Jingwell like, but they say halfway between the knuckle and the nail, or they say where the thingies are, the hairs are. So it's a point that's clearly not well defined. By the name, its name is not clearly defined. So L is translated as the big ugh, damn. I'll look it up in a second. But he adds the character stone to the name. The name actually means, Dun actually means sincere, honest. Okay, so big honesty. But I guess Ellis didn't think that it made sense, so he translated into stumbling, something like stumbling, you know, for Dune. But that's really only if you add the stone character to this character to Dune. So, okay. Anyone else?
Are there more functions of the joy points that you can discuss?
Okay, so the joy points are good for the following. Let's see if I can like summarize it and get it systematized. Anything to do with a head or chest symptoms, because so associated with the Joy syndrome. Okay, in Joy syndrome, your circulation, your chest, you might be panting. I mean, think about if you're walking over a stone and you're tumbling. You're walking on a cliff and you hit a big stone and you're tumbling, okay, and falling. That's basically the syndrome, you know, in a weird way. So the things to do with the head, because that you're falling, you're losing consciousness or something like that. But even headaches, you know, it doesn't have to be. And the chest, because you're going to start panting. Okay, and that falling character actually has a panting component to it. So anything to do with the chest, so that can be cardiac and or lungs, anything to do with the head, and anything where the channel, and that tends to apply to the leg channels, especially if the channel is bumpy and painful. So you know how lots of women have spleen channel and also liver channel is quite common. Very bumpy, very painful. And you want to use a point there and you can't. Because if you're pressing on that point, they go, ouch, and you go, but does it fix your abdomen? Does it do something for the neck? And they go, I don't care, it's too painful. So that's where the Joy point can be very useful. And so you rub your hand against the channel, and they go, you know, whatever, not pleasant. And then you press on the Joy point that's associated with that channel, and then you rub your hand again, and they say, oh, okay, yeah, it's easier. Okay, and then if you want, you can use that channel point that you wanted to, you know, say you wanted to use spleen 7 because they have edema or whatever. Or you might find that the Joy point already accomplished what you already wanted to do with it, with your spleen 7, so you don't need it anymore. So those are the 3 things. Now, sometimes I will, you know, those Joy, okay. There is a whole, I don't know if it's a school of thought exactly. There's a whole method of thinking. You know, everybody likes to find like the little system, the microcosm that reflects everything. And if you use that, it solves everything. You know, we're all familiar with that, okay? Because we have it in ourselves. And, you know, and the bigger practitioner you are with a big name, it's kind of like it's your responsibility to offer that to the world, you know, and then it might be named after you or not, that doesn't matter. So for example, if you're familiar, both Miriam was very into it at one point. These ankle wrist points, they're about 2 to 3 tsun above the ankle or the wrist. And they were Japanese points, even though Miriam was very much a Chinese style practitioner. And those are supposed to be good. Again, they're by the channel, and they're in the hands, and then on the above the hands, above the ankles. The ankle ones tend to be better for the legs and the torso. The hand ones are better for the arms, the shoulder, and the neck, supposedly. And people, you know, would go, oh, the problem is in the Shaoyang. Okay, well, let's do the point that's 2 or 3 tsun above, you know, above the ankle on the gallbladder channel. And you needle it, the advantage is it's under the skin. You needle it upwards towards the torso, under the skin, unless you're using it for foot issue, then you needle it down towards the foot. So that system, again, has this whole idea. You can divide the body into these zones, and
Oh,
it's
okay,
already
yeah.
it's
Yeah.
already
So,
divided for us. The ancients did this thing for us. We can make our own divisions if we want, of course. And then for each one of the 6 zones, we'll have a point. So the Shui points are one more attempt to be able to do that. Find a convenient, easy way to say, oh, it's the Taiyang channel. Okay, go for the Taiyang Shui. So sometimes it works really fabulously, and sometimes it's like useless, and sometimes it does something, and just be flexible with it. But it's worth trying. It's worth trying only, of course, if you're willing to either do direct moxa on it or use a very, very tiny needle. So, anything else? Is there? Yeah.
and the moxa you'd use is thread moxa.
Yeah. Ocu. Yeah. So
Yeah.
direct moxa. Yeah. Yeah. Um, I personally do use cream first. Put a little drop of cream.
Like Shunko, yeah.
Yeah, I use Shionko first. First of all, it keeps the moxa on and it protects the skin a teeny bit. I mean, if you're really good, you can take a teeny thread, like really teeny, hope that it sticks on, light it up, and really, because it's not going to hurt anything. But at that point, you have a little bit of ash. Do another thread that's really very, very teeny. Get a little bit more ash. Now you can use, after the second one, maybe the third one, you can do your regular thread moxa, regular size.
Right. So is it 3, 5, 7, or
Now, honestly,
okay.
I do them so the patient feels something under the feet. Sometimes for some people you will actually see it getting red. Some people you won't, because the skin is very thick sometimes on those people. Yeah. So you do what you can. I mean, we do have, generally speaking, the notion is the patient should feel it 7 times.
Right, that's what I'm asking. Yeah, because
Yeah.
If you've got very calloused feet, you're gonna be there a while.
For hours, it's absurd. So no, the other thing is the moxa gets bigger over, as that happens. They're not feeling anything. Okay, can you take this mountain? It's like, so I do, you do what you can. But I think these numbers are just guidelines. Basically, you're looking for some circulation to happen. Some feeling is very nice. That's okay, not too strong. There are some points that you need extra moxa on. Liver 5 is definitely a point. That's your major point for endometriosis, and it's definitely a moxa point. And it's also a good point for gout. That's a point you do want more. You want to maybe a quote unquote, if 7 is the standard, you want 15 for liver 5. Large intestine 15 is another one that requires more moxa. Okay. I would go for maybe 15 to 21, suppose, however you evaluate. So I'm not really counting the number of moxams I'm doing. I'm really counting the amount of reaction I'm getting by either the patient's reaction is ouch, 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 which hopefully is not like that, but I feel it. And at some point they stop telling you because it's boring. And or by the amount of redness around the moxa. Now you'll see it a lot more clearly, that reaction. It sounds like you do moxa anyway, but you see it like on the inner part of the scapula. That's where you see clear reactions for moxa a lot more clearly than most parts of the body on almost everyone. It's very rare that you do moxa on, say, bladder 42, 43, or bladder 13, area. And you see no reaction at all, like you keep doing it and nothing happens. I mean, maybe the patient doesn't say they're feeling it, but you're seeing a reaction to the moxa. So you can't always transfer it everywhere else in the body. You're not going to see it so clearly, but that's the place where that's like the classical, that's like the whatever it's called, not the flagship, that's what you want anywhere else. You're much less likely to get it on the feet.
When you say reaction, you mean the redness that comes
The
around.
redness, yes,
Good
yeah.
redness.
Yeah.
Now, what about certain points really gives a lot of wonderful peristalsis. And this is the ones that I don't wait just for I from the client. I'm getting very excited that I hear actually the peristalsis, which you put certain points in the body and immediately you hear the tummy gargling, and I see it as a chi moving. What do you think about this?
I think, yeah, absolutely. I mean, I don't know what your list of peristalsis points are, but I can say for myself, I think that almost any point can do that if it's the right point for the person. Because what happens is when you're hitting something that releases some pattern, that addresses a pattern, a held pattern in a person, a certain amount of happens. Okay. Sometimes it's a point that you never thought was a major point or whatever. You know, it just hits the person in the right way, and it gives them the option of a pattern is being released, and then the nervous system relaxes. Because look, most of us walk around as if, you know, yeah, we're not having dinner with a queen right now, but we act a little bit, we hold ourselves, because, you know, it's not very nice to throw up or to have rumbling stomach, you know, in social circle. You know, we tend to sort of like think of it as not quite the right thing. We're quote unquote civilized people. So even when the patient is on, I mean, how many times do you have patients, their abdomen is, there's peristalsis or whatever, and they apologize for it, like, you know, that something is wrong. It's just the nature of our social upbringing. So what happens is a point that does that and sort of bypasses that holding pattern, and then suddenly, yeah, now the intestines are supposed to move all the time. And if they make noise, they make noise, you know, but socially we've adjusted to kind of like pretending that it doesn't exist. And so I guess we're holding a little bit more than we should. So I'm curious to know what the points that you feel are really doing that. I mean, you know, because for me, it's like many different points can do it. I don't have like, I don't really have a list. So I'm curious which ones.
I don't have a list, Avi, of the points. What's happened is that one of the things that when I choose, and I think in my point of view, the right treatment, I put some moxa on certain points. It's so amazing. And I like the explanation that you are giving. It's a part of the relaxation of the human the human feelings about what noise can we make and what we cannot make in a way. So it's really nice. I didn't think about it this way, but it's nice. So when they're in the table, they let go of this fear, if they trust the practitioner, of making noise, and whatever the noise it is.
Yeah.
It could be crying is a noise, or laughter is a noise, and then the tummy does a noise. So I'm working with a woman who, she all her life is constipated, but at the same time she had a lot of abdominal surgeries. The reason she came, it's very clear that she has some really deep scar tissues in her abdomen, and she have a lot of pain, especially on the right section of the body, and constipation. She is 87. So she's an old but very sharp woman. And when I do the points in here, the large intestine, 10, 11, all of it, and I put the points there, so I release all the area of the lower appendix, so there's no more pain there. And then I do, of course, I love stomach 36 as an old age wonderful point, and I do moxa, and the tummy start really going on, and it's really give her a pleasure, and immediately she relaxes and she starts falling asleep. And she talks a lot, but the moment you do these 2 points moxa, she stopped talking, she just go. And so this is why I see it as an interesting, another reaction from the moxa that I get. The local moxa is gargling of the tummy, and a lot of them relax. I don't cause pain. I try not to cause pain or burning, but when they start to say it's hot, I just remove it and be done.
Yeah, cool. Yeah, I mean, yeah, I think that the only thing I would ask is what were the surgeries for?
She had a lot of abdominal and lung surgeries. She is a woman that the way I will describe it, she's an African American, and I, in my heart, ever believe, and I don't want to blame it, but in my belief, she became to be like an experimental body. They did too much surgeries with no need.
But officially, what were they for?
They did a removal of partial intestines. They removed her uterus. They removed the ovaries. They removed her gallbladder.
Did she have endometriosis?
See, the point is that she had she didn't say clearly that she had an endometriosis.
No,
She had-
the reason I'm asking, yeah, I'm asking because when you say there was removal of ovaries, uterus, and part of an intestine, it sounds like the gallbladder we can say quote unquote separately. You know, if we were going to separate, we're categorizing, but you know, I mean, you know, okay, they want to experiment, so they find some black woman, and it was, you know.
They moved part of her lung. She had some terrible pneumonia, so they removed partially part of the lung. Yeah.
So my suggestion would be this. I mean, things that you conceivably to think of adding, you know, not knowing enough about the medical history. But
Yeah. Thank you. Yes, I would love your opinion.
So two things. Well, a few things actually. So first of all, if there was a possibility of endometriosis, see what liver 5 does. Because there are some points that if the person had this disease, you know, and liver 5 is one of those points. So, for example, liver 5, if you had endometriosis, there is no way I can get away. Well, I cannot get away without doing liver 5. Okay, I'm going to do liver 5 on that person. It doesn't matter what they came for. They can come for back pain. And it tends to affect the symptom they're coming for. Okay, it's hugely important. So if there was endometriosis, now, by the way, liver 8 is the equivalent for cysts and fibroids. So anybody who's had accumulations in the body, so that cysts and fibroids, but also fatty liver, for example, is an accumulation in the body. That's a liver 8. That's a style where, you know, of person where liver 8 is likely to be a constitutional point for them. Interestingly enough, this woman did not have her appendix taken out, you know, which you would have thought would be automatic, but, you know. So first I would look at liver 5 as an option. The next thing I would look at kidney 7 as an option also, and if not kidney 7 because of the lung issue, possibly kidney 3 or 4 needle towards the Achilles. Why? Because you said right side of the abdomen, which granted is the, you know, it's also where the gallbladder is for the, so it could be an intestinal inflammation that is pushed up over the years. The woman is 87 after all, into the gallbladder.
This is the way I'm diagnosing, that is some intestinal inflammation. And the first time when I treated her and I touched the right side, she jumped. The second time she didn't jump. And the third time was much better. But how do you deal with something she says, it's burning? What is the word?
When you press?
How do you explain to yourself burning feeling?
Burning feeling can come from many different places. It can be burning can be inflammation. It can be blood vessels, you know, that something is, you know, that both nerves and blood vessels will create that sensation of burning when they're overly rubbed against internally or through something external. So you, for example, you can get a burning from a needle, you know, that sensation. So burning is basically a clogging up of small blood vessels or nerves. Is my belief. I don't want to, I'm not making up the Merck manual. You know, I'm not claiming that I'm quoting the Merck manual here. That would be my understanding. But going back to the patient, just, you know, just as an exercise, the thing is, here is a person who's had multiple surgeries over the years, which means, so you can say there's a lot of trauma, but, and the thing is, it's showing, you're saying it shows on the right side of the abdomen. The right side of the abdomen, when you go from REN 4 towards the right side, towards stomach 25. So that stomach 25, you know, you're moving from I'm confusing my terms because everybody now talks about moving from winter to spring, and there's this whole thing about COVID and blah, blah, you know, everybody loves this. But there's that transition from water to wood, okay, of creating the new. So it's the kidney's ability to regenerate, which you can say someone who's had a lot of surgeries, maybe that ability has been hampered in them. So that's a right side. So for example, 20 years ago, we used to talk about left side stomach 26, 27. It's the famous oketsu, blah, 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 blah. We don't talk about it at all now. Some people still do because educationally it's suitable, but practically in the clinic, it's not all that useful. That's what I call the Clinton era way of working, okay? The 2020s, the 2000s way of working was suddenly you started seeing a lot more right side. You're seeing it even a lot more now. This is the sort of when people feel, and I bet we're going to see even more of it.
Which is the lung side?
It's supposed to be the lung side, and yet it also reflects, so, okay, right stomach 26, 27 officially reflects the following: immune issues, lung issues, digestive issues, intestinal issues in terms of like appendix and stuff like that, because it's right over the ileocecal valve. It can reflect pelvic shift, okay, if their hip, sacroiliac ligaments are weird. And the other one that's not in the dogma is it can reflect the kidney's ability to generate, to move forward. So on someone like that, it makes, and we're seeing a lot more right-sided stomach 26, 27 area on people generally in the culture. And I can talk about that in a second if you want, but and that tends to be a kidney 7 thing, but in her case, because there is a lung component, maybe kidney 3 needle towards the down towards the heel, not towards the Achilles.
Okay.
Do a better job. Also because of the lungs, maybe lung 3, 3 or 4, so 3 or 4 fingers above lung 5 might be a good point. That's a point that really opens up the rib cage.
Point. It's the oxygen point, isn't it?
Yes. It's oxygen in the lungs, not oxygen in the because there's also oxygen in the vessels, which would be lung 8. Okay. And the other thing is, since you're saying you believe the original thing is an inflammation in the intestines.
No, the original. The original really is the lung diseases that came again and again is pneumonias, and then they needed to take part of the lung because pneumonias affect the lower part, the lobe, and so they took part of it, and then I think a lot of neurotic moments came there, and she started complaining about pain, and I think she started getting, and when you ask me about endometriosis, I will ask her, but I think she started getting exploratory surgeries, which I see them as the worst of the worst because they start going in and checking and cutting. But okay, I will not say anything.
No, it's okay. It's of course it's not. I mean, nobody.
I think she received a lot of exploratory diseases because of the neurosis that came in with the loss of the lung and whatever went to her life. And she now has scars and pain, and it's not a simple client, as you can.
No, I understand. So yeah, so the origin is immunity. So because of the pneumonia. So so certainly immune points that you're doing make sense, and as a good starting point with maybe lung 5 or lung 4, or lung 8, whatever. So yeah, that makes sense. I was just offering other things, but if you were going to go for intestines. Yeah, if you were going to go for intestines as intestines, I would try possibly large intestine 1, 2 as a combination. Okay. If you can see that the large intestine name points, large intestine 1 is called Shangyang, the young merchant, or you can say Shang is a musical note, but which is connected to metal, but it's, so we can say the metal or the merchant. It's kind of the same thing. It's exchanging. Yang, and then Erjian and Sanjian, meaning the second space and the third space. So they're clearly referring to, because everybody thinks of the intestines as having 3 spaces, or possibly 5, but at least 3. So in my experience, I can't say that large intestine 2 is a good point for this part of the intestine, the transverse colon, and then large intestine 3 is for the descending colon. But I generally find that large intestine 1 and 2 tend to do a good job. They will not be your major points, generally speaking. They will be decent supporting points for that kind of thing. So that's something to consider.
Okay, so if we're going this far,
Okay.
you remember at Kiko, one of the seminars many years ago, she will go into the fire points and then she will put the 1 and 2. Are you still using this concept, or is this the
Yes, I do, but I do use this concept, but not for this particular thing when I'm talking about large intestine inflammation. So yeah, the concept of if a fire point is painful, use the metal and water. Water overcomes fire. Metal is the mother of water, helps water overcome fire. It's a way of tonifying in order to get rid of a quote unquote pathogen in TCM. So instead of reducing, you're still tonifying, which in the Japanese traditions is always the aim. So yes, I do use the concept of fire points and use metal water, but in this case, I use metal water. I will check, I'll press on large intestine 1 and 2, and then press on the abdomen and see if that releases it. So I'm not that concerned if large intestine 5 is painful or not.
Okay.
Make sense?
Yeah.
Anyone else? No problem.
Would you need
I have a comment, Avi.
Okay, was that John and Mary Jo? Let's start with Mary Jo.
Yes.
You're on my screen, so let's go with Mary Jo, and I think and we'll take John right after. Go ahead.
Just a quick question on that, Abby. Would you use moxa or needle 1 and 2?
I would quite honestly, okay, I would start with a needle because it's a lot quicker, and again, I use the 0.12. Even large intestine 1, they can usually handle it. If the patient's really sensitive and it's not an option, I would just go with large intestine 2. And then if it was really great, maybe if it was that major, I would add moxa. I find, this is just my personal point of view, do not take it as a dogma for anything. I find that a lot of the Japanese practitioners do huge amounts of moxa, and I'm not saying it's useless. Not at all. It's very useful. But it ends up being that every point starts getting moxa, which is fine. Certainly Kawhi did that, and he did real moxa on, he had used thick needles and huge globs of moxa on top of it. It's, the character for acupuncture, Genjyo, implies moxibustion, implies heat. The problem is, it's like how much, can I do this on every point? So I tend to be a little bit more conservative than most of my so-called Japanese colleagues would be. And I don't add moxa on absolutely everything because it takes a huge amount of time, and then the patient gets a little bit like they need some time to be by themselves. So I try and choose 2 to 4 points on each side that I will do ocumoxa on, because if I start doing 8, the people who do 8 and 12 points of moxa, okay, are the ones who generally have assistants. And sometimes they would send the assistant, say, do moxa on this, this, this. Then they come into the room. Then they do what they do, and they say, and now do moxa and blah, blah, blah. That's not my setup. So I prefer to minimize the amount of moxa I'm doing unless I have to. And some of the have to situations, so Carmela, for example, when people have immune issues or lung issues, okay, moxa that's when I say, yes, it's a must. So then I'm not going, okay, be conservative with the moxa. If you're doing the back between the shoulder blades, that is a clear moxa requiring area, okay, in my book. But everything else, it's like I've done immune points without doing moxa. Liver 5 is a moxa point. It's not a needle point, so it's not a question. But every time I do spleen 3, do I add moxa? No. Is it officially supposed to be an add a moxa point? Yes, because it's element on element. Element on element, like liver 1 is wood on wood. Spleen 3, earth on earth. Lung 8, metal on metal. Those are supposed to be moxa points. Okay? But I don't do, I'm not as involved with, I think some of it comes from, it takes some skill to learn to do moxa, and people get very attached to it. So then we create this whole world of, without moxa, there's nothing. It's not quite like that. So it's not automatic logitism 1 and 2. And John, you had a question or a comment or.
Well, two comments actually. The first one, hi. First one is the right side, which you mentioned on the belly, reflex relating to kidney. I wonder what your experience is. Mine is that it's actually closer to the navel than the stomach line. It's more, well, that's my experience.
I can't comment.
Okay.
I don't know.
You can't.
I think it's these areas vary, and like the stomach channel is movable. So I don't have like any clear answer to that. I'll when I get patients again, I'll look at it. I'll try and remember that and investigate it a little more closely. Thank you.
Okay. Second one is, I think, to the moxa in Japan, of course, to be able to be allowed to practice, you will need a couple of years of an apprentice with a master, and or even in school, acupuncture school, as long as you don't have a certificate or sorry, a license, you're not allowed to practice acupuncture at all, not even as an acupuncture student, but you are allowed to do moxibustion. So many people try to be an apprentice in a clinic, and they're very happy if they're allowed to be a moxa assistant. So I think it adds to the whole Japanese tradition for yeah.
No, and yeah, absolutely, I agree, and I think that there is a huge. I mean, yeah, that's one of the things that in Japan it's very common for practitioners to have assistants. Because of this thing, anybody who goes to acupuncture school wants to, and it's considered like a big deal. You generally speaking, because they're not supposed to be needling while they're in school, even in clinic. It's a very odd phenomenon. So suddenly their license is supposed to go out and needle. They do a lot of, this is why there's 2 things that come out of it. You know how Japanese practitioners do this thing of putting the needle back in the guide tube with one hand, and they love that. And, yeah, it's very nice. It's very pretty. It's very, but that's one of the ways that they practice dexterity in the hands. It comes from that training. Like John said, you're going to school. And, in Japan, there's this big concept of like, if you want to be a master of something, it takes X amount of years, okay? And then you become, certified or whatever. You're considered the expert of the blah, blah, blah. It's a little bit like, what's his name? The Jamaican Canadian guy that, you can see his face, but I can't, Gladwell. Malcolm Gladwell, that talks about the 10-year thing, that it takes 10,000 hours to become an expert. So the Japanese pay a lot of reverence to this hierarchy. What happens though, if say I have a certificate in trumpet playing, okay, I have gone through the whole trumpet playing 7-year phenomenon, and I'm a trumpet player expert, and I now want to go and learn flower arrangement, they're not going to ask me to do it for 7 years. It's 1 year. Suddenly the flower arrangement, even though I have to learn how to cut the flower, everybody else just observes for this amount of time, and then you're allowed to bring the flower, then you're allowed to cut the flower, then eventually you're allowed to put the flowers in, in combination. The one who has the trumpet certificate, of course I'm joking because I don't know that they have trumpet certificates, but that person, only 1 year. Why? Because the training is not about the actual dexterity or the manipulation of the instrument or the hands. The training is the training of the mind. So it is assumed that if you have done, whether you've done Aikido or acupuncture or whatever, your mind is supposed to have been trained to be calm, concentrated, respectful, whatever the values in the society are. Therefore, now all you need is the technicalities. So for us as Westerners, it's incredibly annoying. How many Westerners are willing to hand over the flower for 3 years and then maybe cut it at a certain angle, and then maybe they're allowed to cut it at the other angle. It's like we don't have the patience. So it's not our style of learning. But in Japan, that is. So it's taming the mind first. It's what it's all about. So as a result, there's a lot of habits that accumulate, and people, you know, you could say I tamed my mind, but I still have an ego. There's no way I don't, you know, most of us, it's very rare that someone can say, I went through my training and I've lost my ego. You know, so my ego says, wow, doing this thing with a hand of flipping the needle into, that's the beautiful and that's the correct way. And God forbid, if you do it differently, you're just a barbarian. And the same thing with moxa. If you don't do the moxa beautifully and very even size and and there's a lot of rules around it. Those rules, I don't know if they're meant for the patient. And I'm saying, I don't know. I'm not saying I don't want to dictate. But to me, it feels like a lot, from my experience, clinical experience, it doesn't make that big a difference. All this pedantic rules around notes, it's more about training ourselves to be more precise and concentrated. That's my personal opinion. I don't want to impose that on anyone. Anyone else?
That's a lovely thought, Avi. I really, that opened my heart when you told that.
Is there a way for you to, because you sound very, very faint.
Sorry. It was just a quick comment. So, I don't know. I don't know if there's a way.
Okay.
I turned it up. Is that better?
No,
Is that better?
I can hear you, but not very well. But that's okay. It's just how it is. Sorry, but you can use the chat room if you want. Oh, you're on the phone. It may not work easily.
Okay. All I wanted to say was thank you for that thought. It was lovely. That's it.
Oh, you're welcome. Thank you. Osman, you had a comment or question or something?
I had a very quick question. Maybe you are the answer. I'm sorry, I was in and out. I just had an emergency call from Turkey saying that my mom is in the hospital. So
oh, I'm sorry.
And he were just talking about points. They suspect that she had maybe something related to brain, but I guess she's doing well. Anyhow, my question was about large intestine 15. Is there any other indications to use large intestine 15 besides the detox?
Yes.
treatment?
Yeah, absolutely. Number one, I mean, of course, it depends on which book you consult, but yeah, I mean, these are the ones that I use. It's a good point. It's okay. So now for these two, it doesn't have to be large intestine 15. It can be the whole line of large intestine 14 to 15. Eyes and voice.
Eyes and voice.
Yeah. Very good point could be a very good point for vision. And both of these tend to be a little further down towards 14. So either 14 or 15, but it can sometimes be literally 15. And voice, people who lose their voice. Yeah. So for example, I had someone who was an opera singer. She lost her voice. And, you know, so I'm checking and, okay, can you do it? Da, 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 you know, and then so, you know, like we're finding the best point and then the voice gets better and stronger, et cetera, et cetera. So those are the two other like immediate thoughts that I have. By the way, just to give some reverence to the, you know, the people who like holographic images, like the town people, if you look at the deltoid muscle, it can look like the liver. Okay. So, you know, that's why detox and large intestine 15, you know, that's one way to kind of like have a, you know, I mean, all these things that, you know, it doesn't matter because it's kind of like there is a practical experience that says it works, but still, you know, it's just, the other thing is it can also look like an eye, the shape of an eye. Okay. So large intestine. Now the name is, it has the character of a monkey. Okay, it's the shoulder monkey. Now, of course, we know that monkeys use the shoulders. Let me see if I can, you know, I need to see myself to see. Yeah, you can see. Monkeys have huge capacity in the shoulders. They're much more flexible than we are. They reach out much more. So if you think of like, you know, a drunken monkey, quote unquote, like they'll really go berserk and they're show. So it's a way, it's kind of like quote unquote calming the monkey, meaning the you know, calming the drunkardness. Ideology on large intestine 15 a little bit. I don't know if that makes sense or not. But you know, it's just, I mean, these are just like extra fun, not exactly facts, but ideas about points that can help us. Then, you know, because then if we're always thinking about it as detox, it doesn't always lend itself to other ideas. But if you think about detox, oh, like a drunken monkey, you know, that you might have patients that are a little bit like drunken monkeys. And then, and you didn't think about them as, oh no, they didn't work in some paint factory and inhaled fumes, but they still have a drunken monkey syndrome. So then maybe that point works for them. Do you see why I'm expanding the capacity?
So I'm a little bit confused. When you say drunken monkey, they act like that, and it's for calming
Yes.
the sound?
So, okay, so the idea is, when the monkey, the idea is, if not monkeys, but when a human being starts overusing their shoulder, because we generally, we would use our wrist and our elbow, and the shoulder will come into it if you have to. We are not big at using this joint. Okay, we're much tighter, generally speaking, and the same, by the way, is true for the hip. So when a person starts, like if you think somebody who's like not quite with it, like sometimes you see people, they're slurring their speech, and they just gesticulating with their shoulders, whereas most people, like, if you're, say, like me, or you're like Italian or something, you're gesticulating with your hands, with fingers. But some people will start gesticulating, not even consciously, and but there's a lot more movement in the shoulders. Okay, so then it's just something to look at, and that's so. No, sorry. So the expression should not have been a drunk monkey. It's a drunk human acting like a monkey. If that does that make sense?
Thank you.
All right. Anyone else?
Yes, I like to say something since we were before on the large intestine.
Yes.
There's something else that I found out, I think. So I like a little bit your feedback or other people's feedback. Some people will complain about a tailbone pain. Some have purely tailbone injury. Someone have, okay, so let's differentiate the two. I just have a pain without injury, and I have one with injury. And I do see, and I like your opinion, Avi, that people with intestinal issues can have tailbone injury, a pain, correct?
Yes.
Okay.
That is correct. At least I've seen it. I don't know if it's correct by the book, but I've seen it, and I fact no. And I've had
How do you release it? Because injury, we go to this do 14 blood.
Okay. So yeah, so the injury ideology is bladder 66, lung 8, and the water of C71.
One second.
Oh.
The injury one is what?
The water of C71, lung 8, and UB66. These are all tailbone injury styles. It is true, I have seen this, there are people, in fact, I had someone, he was not a patient, a friend actually, who had tailbone pain, and years later complained about it, and I said, why did you come for a treatment? And he didn't, he had all these chiropractors, blah, blah, blah. Eventually it turned out he had colon cancer. Okay, so yeah, so one has to be careful about assumptions, but well, thankfully, to some extent, this, it's not 100% my responsibility to diagnose these things. I don't have the instrumentation, so, but it's good for me to be aware, nonetheless. So the thing about this is, if it is, because it can be intestinal, the first thing I would go for is inner yin, relates to the intestinals very clearly. And again, large intestine 1, 2 is a possibility. So you just go, okay, first of all, you never know if there was an injury to the tailbone or not. Nobody remembers if they fell on their tailbone. You only remember the ones that you remember, because you don't remember the ones you don't remember.
Right.
So yeah, I mean, always bear in mind, if the tailbone injury treatment didn't do it, if you're pressing on the tailbone, at the tip and on the sides of the tailbone, and you're not finding pain, but the pain is like internally, that they're still saying pain, but you can't produce it by pressure, that's a higher chance that it's an internal organic injury. Therefore, worth considering, is it possibly the colon or the rectum? And then, so inner yin would be a big point I would look into, because the adductors and the rectum connect. Largeness of 1, 2 is another possibility. So there are ways to, so just keep playing with what you think, and then always, 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 medical history trumps everything else. Well,
Yeah,
in most cases.
I do. I make sure, but I'm seeing it with the clients with like a celiac disease, or people with the Crohn's, or people with irritable bowel syndrome, and I'm starting to say, wait a minute, I think I'm dealing with two issues in here. I'm dealing with one that, as you said, don't remember, I fall on my tailbone when I was biking as a 3 years old. Probably pretty much possibility, but at the same time, you see the abdomen being bloated more, and then they complain, oh, I sit in front of the computer and always I have pain. So I start putting the two together, and I do different treatments. So I was curious, what do you think? Okay.
Yeah, no, absolutely. I would tend to agree.
Okay.
Anyone else? All right. So is everyone managing in their shutdowns or the possible reopenings or whatever craziness is happening?
I want to try the second week of May to go back, and my plan is to see no more than 5 up to 7 clients a day, and to try to see the ones who are my really regular, my weekly clients, my every other week clients, and pretty much not to encourage new clients right now. So just to make sure that I'm riding everything smooth, changing the chairs from being comfortable chairs to just chairs that are easy to clean, and all the rugs, to remove them out so I can keep cleanliness more in the rooms. Yeah. So to take the rugs out, chairs, and clothes. I'm asking the clients, the email will be, they must come with clean clothes from home. It's not after they were in some store or something.
Gotcha.
Yeah.
Yeah. Anyone else?
Any other suggestion I'm taking?
I'm not quite there yet in the of thinking of opening necessarily, but I'm I mean, people have asked me and I said, well, possibly. Thank you, Camille. Bye. Then I was thinking, just put have a mask on for both sides, just like when you go to the supermarket. That it's better, because the problem is we can't, we're in an enclosed room, and it's hard to, and plus basically not do a lot of talking, just get them on the table, get what needs to be. No, that's why I don't feel I can do new patients right now. It's like patients that it's clear what needs to be done, and they just need reinforcing and whatever. So there's as little interaction as possible, because I have to touch them. There's no way, I can't just dart the needles from afar. And I also, I need to palpate anyway. No, I mean, the voodoo class would have been very useful in acupuncture school, but right now, but I didn't get that. So I'm touching them, but the thing is, so how do we minimize contact for however long this is going to be, and then so at the beginning, obviously we have to be super careful. So the only thing I can think of is a mask. Nothing you don't need a spectacular mask, and in fact you do not want an N95 mask for that, because you don't want anything that's pumping. So you just regular cloth, that's fine in case someone's coughing or they're speaking too strongly, and airing the room in between, making sure you have time to really air the room out. But it's unfortunate. We have to be with the same person for or they're going to be in the room for more than 15 minutes. Whether you're in them for as much as 15 minutes, it's hard to know. But that's the danger. I mean, that's from what I understand, is the thing that they're warning against. Or you can just, maybe in North Carolina, you can have them, move everything to the garden and do everything outside.
I don't think they will get excited, because I do ask people to take their clothes. I don't work with clothes on. I do pretty much bra and underwear, or if they want, they bring their shorts, because they do like to palpate. I'm a palpation. But this morning, and I do need to read a little bit more about it, was very clear, when people say the CDC information at the beginning was, you lose your taste, you have some cough, shortness of breath. And I couldn't believe that whatever I learned in Chinese medicine, I couldn't believe that there's no such thing, chills and fever and body ache. And now they're coming up and saying here's the COVID-19 symptoms. It's chills, it's fever, it's body ache, it's it's a fever, and probably some coughing or sneezing. You know, I don't believe that we don't have Wei Qi in the body with this disease, and everything goes directly to the lungs. It's just not possible. So where is the Wei Qi? And so the CDC says, they didn't use the word Wei Qi, but we do have Wei Qi. We do have chills and fever and body ache. And so before I bring client in each time, I will ask them, do you have any chills? Do you have any fever? Where have you been? You know, and I think, yeah, I understand that maybe some people don't show any symptoms. Even this one down the road, I don't believe in it. I believe that something we experience in the body could be a little bit of sore throat or runny nose or something. The body needs to give me some report. And if no, wow, I'm really worried about my body that I don't have a little bit of information.
Well, I mean, I'll say this. You know, the thing about the invasion of a pathogen from the outside inside, it is a very relative thing depending on the person. And sometimes maybe did go through some exterior Wei Qi battle and the person never registered it. It's hard to know. It is in the Shanhanlun also, there is a discussion about you know, these are stages, these are official stages, but there is a possibility of things moving around in different ways and happening simultaneously, etc. I think the thing about COVID symptomology, notice that a lot of the COVID symptoms that we consider COVID now, 2 months ago, we didn't consider at all, because first of all, we were looking at it theoretically from patients in China. Now, you know, and this is why I think we all have to be very careful to understand this is a disease that, you know, we believe is 4 months old, although now we're saying maybe it's really 8 months old. We don't know. But the thing is, it's a very new phenomenon. If you think that Zhang Zhongjing wrote the Shanhanlun after 4 months of having experience with patients, you know, you wouldn't say, wow, this is a great classic. When we have 5-6 years of dealing with it, we will understand more. Because, so for example, the loss of smell and taste, the skin issues, the clotting issues, these are all things that they're just coming out more recently. Before, we thought it was a pure lung issue because we were looking at it as a respiratory virus. Now we honestly don't know if these things that we're saying now, you know, the blueness of the extremities, the circulatory things, the skin things, in a number of months or years, we might say, yeah, these are secondary. Now, we're also saying many people don't have fever at all. Okay, that's the person. And also some people show it as a digestive virus and not so much as a lung, right? So I think this is too early in the process for us to, so we shouldn't make dogmas yet. We should, you know, like in the last week, I started going to all these seminars that everybody's offering. And I think it's great, but at the same time, I'm taking everything. I mean, you know, and especially if you're like giving herbs and they say these, you know, sometimes you go like, how do you know? Because do you actually have experience? And sometimes the answer is not clear. Some of them are clear that this is the experience from China, etc. And that's fine. It's good for me to take that in. But I'm taking everything a little bit with a grain of salt, because I'm sort of going, look, and it's not that I won't apply it, just to understand that most of our understanding of this disease will happen way in the future. I may not even be alive by the time we know the full story, because just to accept that we don't know, we can't know. And it's very hard for us as practitioners.
We do know, so just a little bit correction. I really, truly agree with everything you're saying, and I really know that we don't know. But if we want a little bit to open, and it's just each person in this form can make their own decision. But I do think I don't want to wait a year or half a year or 2 years to know exactly what's happened to this COVID and then open my doors. So I'm saying, how can I make this the most comfortable for my clients, for my community? So if in the past I've seen, you know how many people a day, I'm not seeing this much anymore. I'm seeing 5. I will scan them. I will make sure that the rooms are airy. So I have 8 rooms in my clinic. So I can see 1 room at the hour and then open the door. So my suggestion was, if someone wants to go and they have clients who are waiting for them, I think we can make it safe in some degree. They can go to Trader Joe's and pick up a bit, and then they get the COVID. You know, what do? Do we live life, or do we stay at home? And
It's a huge, yeah.
my decision is, I want to go back. I know that I have clients who are really in pain, and they're asking me, so when are you coming back? So right now I go there now and I give herbs to people they need in pain or whatever they need. And by the second week of May, I'm saying 5 people, 3 times a week, 15 people, the same people. I feel I'm doing good for them and good for starting the energy of the clinic to go. It's not, oh, it's shut down now forever.
No, my comment was more when you said, oh, where's the Weiqi component? What I was saying is that I wasn't referring to opening or not opening. I try and stay away from that argument. You know, I don't want to get involved because it gets very political and stuff. And I was referring to the fact that how come you know, the Weiqi and components and the chills and the fever and blah, 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 it's supposed to be there. And what I was saying is that we have to accept that our understanding of the disease is developing. So at the beginning, and this is COVID, and now it keeps expanding. And only later on, there'll be a refinement where now, and regardless, even technically, we should still treat to the extent that we can with the knowledge, with the understanding that we have, but just keeping an open mind that I actually don't know. It's one big experiment and it's okay. But it doesn't mean I don't do anything. If I don't do anything, and it's like it's an experiment that's not going anywhere. I froze the experiment away from me. So that's all.
Yeah, okay, thank you.
All right.
Thank you so much for sending me the books.
No problem.
Thank you. It's great. I will read them, and yeah.
All right. Anyone else before we finish? All right. So have a great week.
Thank you.
You're welcome. And I'll be here next Monday, and perhaps you guys will also.
Yeah, I will. Bye.
Bye. Thank you. Bye.